So in this video, we're going to talk about immunotherapies, and this is in addition to the information that's been in the previous video. So immunotherapies are a different type of cancer drug that we use. They can be used alongside chemotherapy, they can be used after chemotherapy, or sometimes you might be on immunotherapy on its own. A lot of the side effects that were discussed in the previous video are also relevant with immunotherapy. Some are less likely to happen, so things like hair loss are less likely to happen with immunotherapy, but there are some toxicities that are more important that you're aware of with immunotherapy. In contrast to chemotherapy, which works on all of your cells, immunotherapy activates your body's own immune system to fight against cancer. There's a couple of ways that this can happen. Firstly, some drugs use a man-made antibody which can fight the cancer cells. Some immunotherapy drugs work by reactivating a part of your immune system that certain types of cancer can turn off. Because immunotherapy activates your own immune system, sometimes what can happen is your immune system can become overactive and sort of attack your own cells, essentially. So particular things to be aware of, in addition to the side effects discussed on the other video, are shortness of breath. Can be a lot more acute with immunotherapy drugs. That can be where your immune system basically starts to attack your lungs. It's a condition called pneumonitis. So sudden onset acute shortness of breath is really important to be seen urgently when you're on immunotherapy. Any yellowing of the skin or the eyes and things like that can be a sign that your liver is starting to struggle. Hepatitis is one of the things that can happen with immunotherapy. That's where your immune system starts to sort of attack your liver. Some patients that are on immunotherapy can also get skin reactions. So some people find that their skin gets really dry, but it is quite common on immunotherapy to get a red, bumpy rash on your skin, sometimes on your face. Again, it's really important that if you experience this, you contact the Oncology and Haematology Assessment Unit so that we can get that treated. Colitis is another toxicity that can happen from immunotherapy, where your immune system becomes overactive and starts to attack your bowel. This causes significant diarrhea, often with blood in the stool or mucousy type stools. So it's really important, if you're on immunotherapy and you have any of those additional side effects or toxicities, that you contact the assessment unit as soon as possible and make sure that they're aware that you're on an immunotherapy drug and you're having these symptoms. Because the way the drugs work is to stimulate your immune system. Often if you have any of these toxicities, we will need to stop the immunotherapy drug initially temporarily while we get everything back under control, and we'll give you some steroids to help dampen that immune response. And once everything's back under control, we can then look at whether we restart the drug at a lower dose or change the treatment plan that you're on. That will be discussed with your consultant if you have any issues. Targeted therapies are another class of drug that we use. Targeted therapies are very, very specific to the type of disease. So certain disease types have been found to have very specific proteins on the cells, and targeted therapies have been developed to identify that particular protein, and the drug will only attack the cells that hold that particular protein. So they're much more specific to treating the cancer. Again, certain widespread toxicities such as hair loss and so on are less likely with targeted therapy. But if you experience any side effects, any problems whilst you're on your treatment, it's really important that you contact the Oncology and Haematology Assessment Unit urgently. It's really important whilst you're on any cancer treatment that if you have any side effects, any problems, or you're unwell, that you contact the Oncology and Haematology Assessment Unit as soon as you can. The nurses will go through a triage with you and they will advise you on what you need to do.